بسم الله والصلاة والسلام على رسول الله صلى الله عليه وسلم.
Cuneiform joint is a multifaceted plane joint. Continue maintaining dorsiflexion of the foot with one hand wrapped around the navicular, thus fixing one half of the joint. With the other hand, the index finger is placed around the medial cuneiform. It is now possible to shear the medial cuneiform into dorsi and plantar flexion as well as medio-laterally. When dysfunction is encountered, a rapid low-velocity impulse is applied with minimum depth across the joint. Medial cuneiform first metatarsal joint is a plane or hinge joint which mainly has a shearing action. Maintaining dorsiflexion with the web of the hand fixing around the medial board of the foot down to the medial cuneiform. With the opposite hand, the operator grips the shaft of the first metatarsal between thumb and index finger. Again, a firm hold is required to allow the operator to shear the first metatarsal on the medial cuneiform. When dysfunction is encountered, a rapid, low-velocity impulse is applied with minimum depth across the joint.
لابد من تثبيت العظمة هنا اللي هو ماسكها باليد. العظمة اللي هو بيثبتها باليد هي أساس المشكلة كلها. لو العظمة دي نزلت لتحت حدث لها هبوط لأسفل تسبب عندي قدم مسطح. لذلك هو بيعمل لها عملية تثبيت مع مفصل الكوع عشان يقدر يحرك باقي العظام.
The subtalar joint consists of the inferior surface of the talus and the superior surface of the calcaneum. The joint is a major shock-absorbing joint because skeleton and soft tissues. Examination of the subtalar joint is carried out with the patient in a side-lying position. The operator fixes the patient's dorsiflexed foot between his thigh and the side of the couch. Using one hand, fix the talus whilst the other hand grips the calcaneum, shearing the subtalar joint into inversion and eversion, assessing for somatic dysfunction. To manipulate the subtalar joint in a side-lying position, it is important to use a cross-armed technique. One hand.
We found out where the navicular is, and what we do is we'll work it through 360 degrees, okay, and then we manipulate with twist grip action, okay, so build up the momentum, so it's a circular movement, 1, 2, 3, and then you thrust it like that, okay. Same with the next one, navicular, fix the navicular, and then we're going to shear the cuneiforms, 1,